Hello, my dear friends. How is everyone? It is always a great pleasure to be here with you. Today, we have a very special and important topic to talk about, and I'm sure you'll be super interested in the subject. If you've been here before or are new to the channel, know that you're in a place where quality information and well-being go hand in hand. Feel free. Get ready to learn more and delve deeper into something that could make all the difference in your life. If you have any friends or family members who could also benefit from this content, be sure to share. Let's go together on this journey of knowledge and care. So grab your coffee, relax, and let's get started. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental condition that affects millions of children and adults around the world. It manifests itself in different ways, such as difficulty maintaining focus, impulsiveness, and hyperactivity. These symptoms vary from person to person and can impact various areas of life, such as studies, work, and relationships. However, understanding ADHD is the first step to managing it effectively. In this video, we'll explore what ADHD is, how it's diagnosed, and the latest approaches to treating it, including medication, behavioral therapy, and natural strategies. We will demystify concepts, break down prejudices, and bring practical tips for those who live with the disorder or live with someone who has it. If you are looking for clear and scientific information about ADHD, get ready for rich and transformative content. I'm sure you'll like our video, so don't forget to like it, as the platform understands that it's good content and that more people might like it. Let's go! A person with ADHD may present characteristics that go beyond simple distraction or high energy. It is a condition that profoundly affects the individual's daily, emotional, and relational functioning. Inattention is one of the main pillars, manifesting itself as difficulty maintaining focus on tasks or conversations, forgetting appointments, or frequently losing important objects. For these people, even routine activities can seem challenging, as their mind often wanders to other thoughts without them realizing it. Hyperactivity, another striking characteristic, is not limited to physical agitation, such as shaking your legs or not being able to sit for a long time. It can present itself as mental restlessness, with a flood of thoughts that makes it difficult to relax or sleep. Impulsivity is reflected in sudden actions, such as interrupting speeches, speaking without thinking, or making decisions without considering the consequences, which can generate frustration and misunderstandings. However, these characteristics are not isolated, they are deeply connected to emotions. People with ADHD often feel intensely, which can result in angry outbursts or sudden mood changes. This does not mean that they are unstable, but rather that their brain responds differently to stimuli, often amplifying emotions that go unnoticed by others. These manifestations can vary widely from person to person. While some face notable challenges at school or work, others develop creative ways to deal with difficulties. It's important to understand that behind agitated or distracted behavior, there is someone struggling to adapt to a world that often doesn't understand their unique way of functioning. Identifying a person with Attention Deficit Hyperactivity Disorder, ADHD, involves observing a series of behaviors, difficulties, and interaction patterns that are common in the disorder. Although the definitive diagnosis must be made by a healthcare professional, some characteristics may be indicative of ADHD. Below are the most common signs, divided into the categories of Attention Deficit Hyperactivity Disorder, impulsivity, as described in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, and in sources such as the National Institute of Mental Health. Signal 1. Attention deficit. People with ADHD, especially those with the predominantly inattentive type, may exhibit the following behaviors: difficulty paying attention to details, making careless errors in school tasks, work, or other activities due to distraction. Difficulty maintaining attention. Problem staying focused on daily activities or prolonged tasks such as reading or completing tasks at work or school. They don't seem to listen when they talk to them. Even without obvious distractions, these people may appear not to be listening. Difficulty following instructions. People with ADHD often have difficulty completing tasks or following orders. Forgetfulness and disorganization. There may be difficulties in keeping material organized, losing items, or frequently forgetting appointments. Signal 2. Hyperactivity and impulsiveness. People with ADHD, the impulsive hyperactive type, may experience constant restlessness and excessive movements, such as flapping their hands or shaking their legs, especially when they are expected to remain still. Talking excessively. Tendency to speak impulsively and interrupt other people. Difficulty waiting your turn, impatience in situations where it is necessary to wait, for example, in queues or when waiting to speak in a conversation. Impulsive behavior, making quick decisions, often without thinking about the consequences, such as spending money without planning or engaging in risky activities. Signal 3. Emotional and social behaviors. Problems in interpersonal relationships. Impulsivity and difficulty in controlling one's own behaviors can harm social and family relationships, generating frustration and disagreements. Intense emotions and mood swings. Extreme feelings of frustration, anger, or joy may be more frequent in people with ADHD. Difficulty dealing with criticism. People with ADHD may be more sensitive to criticism or disapproval, which can affect their self-esteem. Signal 4. Symptoms at different ages in childhood. Children with ADHD often have difficulties at school due to constant distraction, behavior problems, and impatience, as well as difficulty following rules. In adolescence, teens with ADHD may have difficulty maintaining good academic performance and may more easily engage in risky behaviors, such as substance abuse. In adulthood, even after childhood, many adults with ASD continue to experience difficulties in holding down stable jobs, maintaining healthy relationships, and organizing daily tasks. Pay attention to signs and diagnosis. For a diagnosis of ADHD, symptoms must be present for at least 6 months and occur in more than one environment, such as school, work, home, etc. The diagnosis is made through a complete clinical assessment, which includes interviews, observations, and, often, questionnaires filled out by family members, teachers, or other professionals. Regarding treatment, it is important to combine different approaches, such as medication, behavioral therapy, and lifestyle changes, to help people with ADHD manage symptoms and improve quality of life. For more information, you can consult sources such as the National Institute of Mental Health and the DSM-5 for details on diagnosis and treatment of ADHD. The causes of ADHD, attention deficit hyperactivity disorder, are multifactorial, involving a complex interaction between genetic, biological, and environmental factors. Genetics plays a significant role. Studies show that ADHD tends to be hereditary, being more common in families where there are already cases of the disorder. Neuroscience research points to changes in the structure and functioning of the brain, especially in the areas responsible for attention, planning, and impulse control, such as the prefrontal cortex and the circuits linked to the neurotransmitters dopamine and noradrenaline. Environmental factors may also contribute to the development of ADHD. Exposure to toxins such as lead during pregnancy or in the early years of life may increase your risk. We can talk more about this if you ask, but I can tell you that there are many sources of lead poisoning, including deodorants. We must pay attention to the components of the products we consume. In addition, prenatal and perinatal complications, such as premature birth or low birth weight, are also associated with the disorder. However, it is important to highlight that environmental factors alone do not completely explain the emergence of ADHD. Generally, they interact with genetic predispositions to trigger the condition. ADHD is not caused by factors such as poor breeding, excess sugar, or excessive use of technology, despite popular myths that suggest these explanations. These elements can exacerbate symptoms in individuals who already have a predisposition but are not the root of the disorder. Understanding the causes of ADHD is essential to demystify the disorder and ensure that treatment is effective and evidence-based. Treatment for ADHD, attention deficit hyperactivity disorder, involves a combination of approaches to help control symptoms and improve the affected person's quality of life. Treatment is generally individualized, taking into account the severity of symptoms and the specific needs of each patient. Here are some of the main approaches used. Number 1. Medication. Medications are often prescribed to help improve the symptoms of ADHD, particularly in more severe cases. The most common include stimulants. Medications such as methylphenidate, Ritalin, and the amphetamines, Adderall, are widely used to treat ADHD. They help increase concentration, reduce impulsivity, and improve motor control by altering dopamine and norepinephrine levels in the brain. Non-stimulants medications such as atomoxetine Strattera and guanfacine Intuniv may be prescribed when stimulants are not effective or cause unwanted side effects. They also help control impulsivity and improve attention. Number 2. Behavioral therapy. Behavioral therapy, especially cognitive behavioral therapy, CBT, is effective in treating ADHD. CBT helps people develop skills to control impulses, improve organization, and develop coping strategies to manage symptoms more effectively. Behavioral therapy may include social skills training, helping individuals improve their social interaction and control impulsive behaviors. Organization and planning strategies. Teach ways to improve organization in everyday life, such as using lists, reminders, and calendars. Number 3. Educational interventions. People with ADHD often benefit from adjustments to the school or workplace environment, such as workplace or school adaptations, such as extra time for testing, use of assistive technology, apps for organization, or clearer and more direct instructions. Learning skills classes. Techniques that help you better organize information and increase focus during studies. Number 4. Lifestyle changes. Healthy lifestyles also play an important role in controlling ADHD symptoms. Regular physical exercise. Regular physical activity can improve concentration and reduce hyperactivity, as well as helping with emotional regulation. Balanced diet. Some studies suggest that certain foods can affect behavior, such as foods high in sugar or artificial colors. A diet rich in essential nutrients, including omega-3s and antioxidants, can be beneficial. Adequate sleep. Lack of sleep can worsen ADHD symptoms. Creating a regular sleep routine is crucial. Number 5. Complementary approaches. In addition to traditional treatments, some people turn to alternative therapies, such as the use of nutritional supplements or relaxation techniques, meditation, yoga, although results may vary and should be discussed with a healthcare professional. Effective treatment of ADHD is multifaceted and depends on a combined approach that includes medical interventions, therapies, and lifestyle changes. The key to success is customizing treatment, taking into account each patient's specific symptoms and circumstances. These treatments can help to significantly improve the lives of those suffering from ADHD, but as you know, it is always important to seek out a specialized professional for appropriate evaluation and monitoring. So, guys, we've reached the end of another video. I hope you enjoyed the content and that it brought useful and inspiring information to your day. Remember, here on the channel, our goal is to always share knowledge in an accessible and welcoming way so that we can all evolve together. If you liked the video, don't forget to like, subscribe, and activate the bell to stay up to date with everything that happens here. I'll leave 2 video options here for you. I hope you like them. And of course, share with friends and family who can also benefit from the tips and information we bring today. Your interaction is very important for the growth of our channel, and I sincerely thank you for your support. See you in the next video, and take good care of yourself.